Welcome back to another episode of In the Spotlight from the Marketers Toolkit. I'm your host, Virginia Shower, and today I'm so excited because I have the absolute pleasure of bringing you someone who is not only an incredible physician, but also a visionary who has created some really cool things inside of the SaaS and HighLevel ecosystem that I cannot wait for you to see. Dr. Ronya Green. She's a board certified primary care physician who runs a thriving concierge practice in Middle Tennessee. When she set out to build a more personal, human style practice, she ran straight into the same problems many providers face: disconnected systems, duplicated admin work, technology stack that wasn't built with clinicians in mind. So most people would just adapt, but Dr. Ronya built something better. She created Care Nexus, a fully customized HIPAA-aligned practice management solution that unifies marketing, patient care, prescribing, automations, data tracking, and practice workflows all in one place. And now she helps therapists, physicians, med spas, chiropractors, and cash-based providers streamline their entire practice with the same system she built to solve her own pain points. So in today's episode, Dr. Ronya shares how she transformed HighLevel into a clinical powerhouse, the surprising ways she's improved both patient experience and her quality of life, and how she uses customizations to help her medical providers reclaim time, revenue, and sanity. So if you've ever wondered what's possible when industry expertise meets powerful technology, this conversation is going to inspire you. So let's step into the spotlight with Dr. Ronya Green. Welcome to today's episode of In the Spotlight series from the Marketers Toolkit. Today we have Dr. Ronya Green here with us. Thank you so much for being here, Dr. Ronya.
Thank you so much for having me, Virginia. I'm really excited to talk to you today.
Awesome. So tell us a little bit about your background as a doctor and then what made you come into the SaaS environment.
Yeah, so it's been quite a serendipitous journey for me. So I am a primary care physician and I own and operate a concierge practice in Middle Tennessee. And when I started out with my practice, the biggest uplearning for me was really the marketing piece. Like, although concierge has been out for a few years, it's still quite new to people. So educating individuals on what this means to see a physician without using commercial insurance and what type of care we provide. It really required me to flex my marketing muscle, which I did not have to do when I was an employed physician because all that's done for you. And so that was really my introduction to a CRM. And this concept of lead magnets and building an email list and nurturing people to the point of sale. And so I had all of these other tools that I was using in terms of CRMs, Calendly, and then I had to have an electronic health record to manage patient care. And I quickly grew very frustrated because none of these things talk to each other. And I saw myself just doing like duplicative administrative tasks. And I was like, this is not why I went into private practice. I went into private practice for more freedom, more time with my patients, more time for myself and my family. And suddenly we're stuck, putting the same information in multiple places. And so I was lamenting to a tech friend about this. And he was like, you can do this. Like there's, a SaaS platform that can help you with this. And I already had some familiarity with HighLevel because that was a CRM that I was using. And so I said, well, really? Like, how would that work? And so that led us down the path of customization and then the integration of a white label prescribing platform so that it truly became the one solution to manage my practice from beginning to end. And so here I am in the SaaS space, sharing it with others like me. So it's been a fun journey.
That's awesome. So do you sell your SaaS to
Yes. So it's called Care Nexus, and we provide subscription to membership-based or cash-based providers. So think therapists or behavioral health practices, primary care practices, med spas, chiropractors. Those are our target audience, whether they need to prescribe medications or not.
Yeah. Oh my gosh, that's so great. And so I assume too you have the HIPAA compliance, all of that with your system. That is great.
Yes.
So What is the one thing that you're most proud of with your agency right now?
The thing that I've just found a new passion around is helping providers solve their pain points. That has been really interesting to me because of the customization that's available with the high level and the marketers toolkit. We can make your management software look however you want it to look, the customization of the notes. So when, using the calendar feature, a patient schedules with me. There's a form there that says the reason why they're coming in, and there's a workflow behind that. So when they select their reasoning for coming in, there's a note template that comes in for me that's preloaded with how I typically document my patient care notes. And so that at the time of visit, I'm able to edit it and sign it, and it's done. I didn't have that particular luxury when I was using a traditional EMR system. I had templates, but they weren't templates connected to notes. And then the back end automation of after the visit, the visit has concluded. So then there's automatic emails that go out to my patients with their patient education. What did we talk about today? What are our next steps? People need reminders of any orders that I've placed and things of that nature. But then also another email goes out linking to my Google page so that you can send a review. And
Oh,
so then
that's
that's
great.
how I am able to increase my SEO for my practice without the awkwardness of actually asking you to do a review on my behalf. But an automation goes out to serve that. So, I mean, it has been a game changer for me. And so I get really, really excited about sharing that with other clinicians.
That is so cool. Do you have a success story of one of your clients that you can share with us about something specifically to their customization that you've been able to do?
Yeah, so recently we have been able to onboard a surgeon, which is super exciting
Wow.
to me because, yeah, I'm a primary care physician reaching out across the specialties, but a surgeon who is very specialized in different practice that they provide to individuals. And one of her pain points was gathering data on her patients' conditions before she even saw them, and then continuing to collect data to see how their condition progressed. And so we were able to customize survey quizzes for her that the patients receive again at the time of booking that they'll complete in the email. We paired that with the custom value fields so that all of that came into the contact profile, and she's able to track it, with the scoring. And then there's another survey that goes out if you're an established, patient, so we can kind of follow up on where we first started that initial survey and how those scores look different throughout the course of the treatment that she's doing with them.
Oh,
So
that's so cool.
yeah, then, it's her practice management, her clinical care, but then we start thinking about now you're tracking data, right?
Yeah.
Perfectly positions you to then have more influential conversations with pharmaceutical companies and
Yes.
parts of industry that are curious about utilizing your patient population. You then have some metrics that you've been able to track all within your system that you're not necessarily running another report or need, a research assistant to delve into. So I'm super excited about the customization pieces and the success that our clients are having with Care Nexus.
That's amazing. Do you want to share your screen with us and share with us something that you've created?
Yes, absolutely. I'd love to share just kind of like what the profile here looks like. Can you see this okay, Virginia?
Yes, yes, it's
Okay.
perfect.
All right. So obviously for HIPAA reasons, I just have myself pulled up as a sample patient. But you see, with Marketers Toolkit, we were able to customize our side panel and change contacts to patients to give it more of a feel of our approach here. And then some of the other customized links that are related to our prescribing platform. And so we added a button that allow us to go right into the iframe and allows us to prescribe medications. So
Oh,
you see
that's
the
great.
here that's been sent for the patient, so you can add. We have some favorites already picked, so I'll go with that one. But the pharmacy information pulls in just like a traditional electronic prescription that a provider would need to send. So you save it, and it is electronically sent if I just click this button and send it over to that selected pharmacy, and it's gone.
Amazing. Amazing.
Yeah, so I mean, I really love this feature. I mean, all of the correspondence, that we've had with the patient, whether it be an email or a text reminder, all in one place, that you really just can't get in a traditional EMR system. The information is kind of fragmented and you have to bring it back into the patient's chart. But this is in one place that I'm tracking everything: patient's payments, their medical care, patient care notes, any medications that I've prescribed with them, any appointments that they've had with them, all of the traditional features that we love about HighLevel that we've been able to customize for a practice.
Amazing. And so when did you actually come into finding the Marketers Toolkit?
Of last year.
Last year?
Yes, yes. So last year, again, I'm grateful to be introduced to the Marketers Toolkit by a marketer who was utilizing it and told me about the amazing benefits and being able to customize my back end. So it's really been an asset, not only to my practice but obviously to the agency, and being able to sell the subscriptions to the agency.
That's amazing. That's amazing. And I love the details. I love the look, the very professional look that you have. I love the aesthetics that you have created with the Marketers Toolkit as well on that sidebar. Would you mind pulling that up again so we can just look at the sidebar menu?
Yes.
And did you reorganize the sidebar menu, or is it in the same order? I'm going to look at it again and see.
Yeah, it's slightly reorganized. We also kind of added some fields here that will bring us directly to like labs.
Yeah.
So to send in labs for patients, or utilizing a second compounding pharmacy. So again, it really changed the game for me in not having to leave this space to
Yes.
manage patient care needs.
Yes, exactly. Exactly. That is so good. There's all those little details too that are in the marketer's toolkit that I personally forget about that's inside. But you shared a lot. Thank you so much for these shares. Is there, with somebody starting out their agency, if you could do it all over again, what advice would you give to them?
Oh, wow. For starting an agency, there's so many things, so many features. As you alluded to with Marketers Toolkit, we were just talking and I was like, what, Virginia does that? Like, I didn't even know that. I'm missing out on some more features that I could be using. But I think maybe concentrate on one thing at a time so that you don't
Yeah.
feel overwhelmed in trying to drink the ocean, if you will. Master one thing within your system and then move on to another. I hear a lot of agency owners talk about having subscription models that really just feature one part of HighLevel, and how the Marketers Toolkit helps them with that. Like, so for instance, customization of AI agents or the dashboards. People are really interested in tracking data and KPIs. So that's my advice, is to figure out that one thing and then expand from there.
That is awesome. Thank you so much for this. These nuggets were so good. And I know that people who are getting into, especially the medical industry, can really use some of your ideas that you've brought forward today. So thank you so much for being so generous with your information and with your
Yeah, I thank you for having me. It's truly my pleasure. I hope, from the perspective of medical providers and clinicians, getting them to understand how important it is to have strong systems in place is when you start. That's my advice for them, is like having strong systems when you start, as opposed to getting tied up into multiple different platforms that you then have to untangle when you realize it's just not working for you. So
That is really
that's
important. Not knowing exactly what solutions you were solving at first. It wasn't until you really got in there and started working in the system that you knew you had problems to solve. Does that make sense?
Yes, yes, absolutely. And like I said, for me, just the marketing piece of it was a new learning curve. So that piece of it was, and then like, oh, I wasn't fully using my back end to its full capabilities. Quite honestly, in the
Yeah.
beginning, because I was like, well, you could be doing even more automations and workflows for this. And so going through that, and then even now being challenged by some of our clients with some of the things that, listening to their issues, and then me knowing what the back end can do, I'm like, oh, there's a connection for that. There's actually an easier way. We can do that. So yes, I've been both, surprised and delighted by just the expansion of what we've been able to do between our partnership with High Level and the Marketers Toolkit.
Cool. Cool. Well, thank you so much again for being on with us today.
Yeah, this was fun. Thank you, Virginia.
Hey, it's Virginia again. I wanted to pop back in after the interview. I've had some time to sit with everything that Dr. Ronya shared, and I just want to highlight something that really stood out to me. When we talk about building a brand or building a system, people usually jump straight to colors, logos, visuals. But listening to Dr. Ronya, it's so clear. Real branding is about solving problems. It's about creating an experience that actually supports your clients in the way they need. And that's exactly what she did. She didn't just make High Level look pretty. She made it functional. She made it intuitive. She built an interface that works the way medical providers think, with buttons, workflows, and customizations that honestly just don't exist in High Level on its own. And that's where the Marketers Toolkit comes in. The theme builder and the agency plan give you the ability to create those custom interfaces and the layouts and the user experiences for your clients, the things that turn a CRM into a true solution. You get the power to solve bigger problems, charge higher retainers, and actually stand out in your niche. So if you're ready to build systems that not only look on brand, but work on brand, head over to themarketerstoolkit.com and explore what you can create. Thank you so much for being here. Thank you again to Dr. Ronya for her insight, and I'll see you in the next episode.